In this example, we will look at setting up a different message to be sent out for our new patient appointments. Click on the Add SMS Schedule button found in the top right. Click the Type drop-down menu and select Appointment Reminder. In the name, you can add in New Patient or NP. Once again, if the message applies for all providers, simply leave the provider field blank. In the Appointment Types drop-down, we want to click to select New Patient. If you have multiple new patient appointment types in the list, simply repeat the steps to add the additional ones. As a default, Gentu has 3 days before appointment set. If you do not want patients to be calling in on weekends, click to change to working days. Over to the right is the Send Time dropdown. If this dropdown is left blank, Gentu will simply stagger the appointment reminders throughout the day, based on the patient's original booking time. So for example, if the patient is booked in at 9:30, they will receive an SMS at 9:30, 3 working days prior. However, if you would like the SMSs to all be sent out at the same time, simply click on the dropdown and select your desired time. As a default, Gentu will tick Don't Send if appointment status is applied. What this means is that if a patient's booked in their appointment and their status has been updated to confirmed, the patient will not receive this reminder via SMS to confirm their appointment. Gentu will display a generic appointment reminder message. If you have set up different SMS templates, you can select the template from the Insert Templates dropdown, or alternatively, you can edit the message accordingly. In this example, we may want to include a prompt asking the patients to come in 10 minutes prior to fill in relevant paperwork, or maybe to include parking instructions or directions to the consult rooms because you may be located in a large hospital. Or maybe the practice has a link to an online form, which can be then included in the actual SMS. To save, click on the Save button found in the bottom right.